Healthwatch Bradford and District is an independent organisation working across the local authority area to give people a stronger voice on the health and social care services that matter to them.
We've got a great team of staff who are out and about all the time in the Bradford District listening to people's experiences of health and social care services. But another really important part of the way we do that is to work with groups of volunteers from different parts of the community who are out in different health and social care services, asking people what's good, what's not so good, what needs to be improved.
Healthwatch is a small organisation with a big job to do, so we really value all our volunteers. We've trained young people to volunteer with us, and the whole team enjoy watching them gain valuable experience and grow in confidence.
I first heard about Healthwatch when Afsana and I think Marcella came to Bradford College and told us about Healthwatch and asked for volunteers for the BRI outreach programme. And I wanted to volunteer because at that time I wanted to become a child nurse. I thought working in a hospital, environment probably gave me, talking to other nurses there as well would give me more of a reason for, wanting to go into that area. And then another reason I wanted to do it was because I thought it helped me gain more experience and confidence, just volunteering basically and talking to the people. When I first started at BRI, it was really nerve-wracking, but you get used to it at the end because different patients have different stories to tell, and the elderly tend to want to talk more than the young ones. But yeah, it was great. And the other things I've done whilst volunteering is the BRI walkthrough, where I walked through the children's ward, and ended up writing a report on the improvements they could make, which then sent to BRI Hospital, who have read through the report and actually had followed through some of the recommendations. And being part of those improvements felt great because it showed, once you wrote the report and the recommendations were being followed through, showed that the hospital was actually listening to what the people had to say. Because it wasn't just us making the recommendations, we talked to some of the patients, families of patients there, and they had a few things to say which we also wrote down. So it showed that the hospital is listening to the patients and their families as well as us.
It's vital that Healthwatch reaches out to different communities, particularly in a diverse district like Bradford. Often we do this by working in partnership with other local organisations that help us to connect with people and hear about their experiences.
Bradford People First and Healthwatch have worked together by joining in with events together to promote the services. We've also become health watchers, and this enables us to get information and stories from people with a learning disability and pass on that information to Healthwatch, to both good and bad stories, to try and help improve services for people with learning disabilities.
One example of where we worked with a group of people who may not perhaps commonly give voice to their experiences is about our work with people with learning disabilities, and we've worked with People First in both Bradford and District in partnership with them, which is a user-led organisation by and for people with learning disabilities. And we've trained them to become what we call enter and view representatives, who go out and visit local services and give us their perspective on what's good and what needs improving.
A group of our volunteers recently carried out a visit to a social care service in Bradford called the Learning Zone, which provides leisure, learning and employment opportunities for people with a learning disability.
Well, we came to the Learning Zone today because we've heard that this is more of a newish service from September, and we knew a few people through People First that come here for the day centres and the courses that they do. And we basically come to ask them questions to make sure that the service meets their needs and their requirements.
Made me feel important when asking questions and that.
Our volunteers can make a real difference by gathering important feedback from others and by using their own insight and experience to improve the services that matter to them.
I have Down syndrome myself, and I don't really require any services. But my brother required a lot of services, and I've cared for him for many years. So, and his experience with his services wasn't actually as good and effective as they should be, which encouraged me to get involved in something like this because I didn't want anyone else to be affected the way my brother was. To be honest, being part of the Healthwatch team and all the other charities I've been a part of, I think We're like one big family, really. We've all come together with one aim, to give people with disabilities a voice. And for us to do that together and to celebrate our differences, that is the main priority we are here, and that's why I love what I do.